Hello and good afternoon, everyone. So I am Oksana Pradhan from Medhavi Skill University, currently pursuing Bachelor in Radiology in Imaging Technology, third semester student. Let's talk about the case mammography. So basically, mammography is a low-dose X-ray detection used for early detection of breast or other breast for early detection of breast cancer and other abnormalities. It involves the compression between the two plates uh, and which can show signs like tumors or calcifications. There are two signs like tumors, calcifications. There are two main types, the two main types of mammography. The first is screening mammography, and the second is diagnostic mammography. So, in screening mammography, it aims to detect breast cancer in people with no symptoms. This is a routine checkup to find any potential problems early. If I'm having breast cancer, but there will be no symptoms of breast cancer. So I will not get to know if either I have breast cancer or not if I don't do a routine checkup. So another type is diagnostic mammography. In diagnostic mammography, it's usually used to investigate specific signs or symptoms. In diagnostic mammography, I will get the signs and symptoms of breast cancer, and I would have to go for the checkup either to to have a confirmation either I have a breast cancer or not. So let's talk about the procedure, what to expect during the procedure. The process is quick. We're talking about 5 minutes. The compression for each image lasts 20 to 30 seconds. You may feel some discomfort due to breast compression, but you will need to hold very still and maybe ask to hold your breath for a few seconds to avoid a blurry image. For some amount of second, you have to hold your breath to get a clear image. Otherwise, if you won't hold your breath, you will get not get a clear images. Mm. So, talking about the benefit and risk. So, benefit mammography is one of the most effective way to detect breast cancer early. So, when treatment is more successful and the risk of dying from the disease is lower. So the risk, it involves a small amount of radiation, so the risk from a single exam is low. Your body will absorb the small amount of radiation, so it will be a little risky, not so risky, but it counts on risk. So mammograms can sometimes lead to false positive, finding an abnormality that turns out not to be cancer, or false negative, that means missing a cancer that is present. So now I would like to show you the video about the mammography, how this the machine looks like. And just wait a minute. So yeah.
A mammogram is a picture of your breast taken.
So in this video, you will get to know get to know about how the mammography machine looks like and like how are the procedure and the positioning of the mammograph are going to be. So let's start it with the video.
With a safe, low-dose X-ray machine. Your technologist will ask you to stand facing the mammography machine and then place one breast at a time on a flat surface. Another flat surface, called a compression paddle, will gently be lowered into place to compress your breast. Compression is necessary to spread out the breast tissue and to eliminate motion, which may blur the.
So this compression, why is it important to see the tissues? With the help of tissues, we will get to know about what kind of lumps we are having for the cancer. To get a clear image of tissues, we have to compress it. We have to do a little compression on the breast. As you can see on the video, that two plates are compressing and between the breast. Let's look at it.
image. The compression may be uncomfortable, but shouldn't hurt. Compression usually lasts no more than 20 to 30 seconds. During this time, an X-ray beam comes from above and penetrates your breast tissue.
That I've already said that it takes 20 to 30 seconds. And from the above, as you can see, that the X-ray it falls down on the surface and it penetrates.
The X-ray image is either created on a film cassette located below your breast or recorded digitally and stored in a
It's either it's either called the image. It's either will get on the cassette or either by the digital technology by digital machine.
computer. Denser breast tissue, such as cancer or calcifications, appears bright and white, whereas less dense tissue, such as fat, appears dark or gray. After the X-ray is complete, the compression will release and the technologist will change the angle of the machine. Again, position your breast on the flat surface, gently lower the compression paddle, and take one more X-ray. Following the procedure, the images are processed and made available for review and interpretation by your doctor.
So, like the X-ray is done in two times by changing the positions to get a clear and the better images and to know about what the either the patient is having a breast cancer or not. So now, moving forward, I would like to show you the book chapter paper which I have. You can see. So this is the book which I have referred, and from this book I've referred one paragraph. I will show you, and the book is from of the Atlas of Mammography, third edition, and the founder and director of this book is Ellen Saute Paredes, MD, FCR, clinical professor of radiology from the University of Virginia, School of Medicine. So now I would like to show you the book and the abstract I've taken. So the abstract tells us that mammography is a well-established technique that has been proven to reduce the death rate for breast cancer in a screened population of women. Since the last edition of this book, major changes have occurred in the breast imaging. Mammography has been well established and is utilized as a screening and diagnostic tool. Breast ultrasound and MRI are also used frequently in the evaluation of abnormalities. Breast interventional procedures are more varied and serve to diagnose breast lesions. Digital mammography has been developed, approved by the Food and Drug Administration, and is utilized in the United States and abroad. The Mammography Quality Standard Act was passed by Congress and implemented, and is an important mechanism for standardizing and improving the quality of mammography services. The training of radiologists in breast imaging is now a well-established component of radiology residence programs, even with improved techniques, tools, and training. The challenge for the radiologist remains to identify breast cancer when it is small and curable. So in this paragraph, you will get to know about with the help of mammography, with the help of these mammography scans, the women who had, the people who are dying from the breast cancer, the amount and of the people losing their life because of the breast cancer has been reduced with the help of this scan, the mammography scan. So next, I would like to show you the research paper. And in this research paper, I also have taken a small abstract. So this abstract tells us that a positive experience in mammography is essential for increasing patient attendance and re-attendance at these examinations, whether conducted for diagnostic or screening purposes. Mm. Mammograms indeed facilitate early disease detection, enhance the potential for cure, and consequently aiming to improve the patient experience in diagnostic and screening mammography. So this tell as a positive experience in mammography is essential for increasing patient attendance and re-attendance at this examination, whether conducted for diagnostic or screening purposes. Mm, yeah, the mammography is done to like to ensure that patient isn't having any lumps, any effect of having growing breast cancer in the body. Next, I would like to show you my lab video. So, yeah.
Myself, Optional Pradhan. So today I'm here to talk about the topic mammography. Mammography is a low dose X-ray of the breast used for early detection of calcification or abnormalities of breast cancer. So it involves the compressing of the base between the two plates. It compresses the base to get the clear images which can offer signs like tumors or calcification. So mainly there are two types of mammography. First is screening mammography and diagnostic mammography. So on screening mammography, it aims to detect breast cancer in people with no symptoms. It is a routine checkup to find any potential problems early. So in diagnostic mammography, it used to investigate specific signs or symptoms like such as lump, pain, or necklace discharge. So how it works? So each breast is positioned. Right now, I don't have a mammography machine to show you or demonstrate you. So I will just theoretically tell you. Each breast is positioned onto the platform and compressed by each pedal for a few seconds or flatten the tissue and reduce extra exposures. The technologist takes at least two images of each breast from different angles to get a complete picture and overcome tissue overlap. Thank you.
So this is it. This is the video of me on the lab. So basically, in this video, there in our lab, there is no any no not there's not a mammography machine to show you. So I would like to. There's no mammography machine, but I've just theoretically explained what is it. So just a second. So yeah, these are all the findings, my findings on the mammography, the book chapter, the lab videos, the case videos, which I have showed you all. These are the amount of information which I would give you. And thank you for watching this video and hope you all have gained something and you all have learned something from this video about the mammography. Thank you.